We're going to talk about eyes. I'm absolutely fascinated with eyes. I think it's just an incredible organ. So I hope you find this as interesting as I do. So eyes, we see a ton of eye emergencies in the horse. So why are we seeing all these? Well, we know the horse is a flighty type of animal, right? So just their innate flight response contributes to it. They have these incredibly large eyes, and where they're located, it just makes them more predisposed to injury. Torn eyelids, a very common emergency that we see. They're often snagged on buckets and snaps. Ideally, we want to suture these as soon as possible, and even though we're looking specifically at the eyelid injury, we want to make sure that there's no injury to that cornea. That's the outer covering of the eye, okay? So we've got a photo here showing two examples of hanging buckets. Hopefully with this, I'm going to save you maybe a $400 bill someday, okay? So we've got the bucket on the left side is hung up. I don't know if you can see that, but the snaps here are turned facing the horse. And again, they're flighty animals, so if they're in either drinking or they're eating and they all of a sudden, swing their head up, they can easily catch their eyelid, any loose bit of tissue onto the snap here, and it gets pinched and then it tears. Sometimes they also snag their nostril and we get nose piercings, okay? So, and the other thing the gentleman had mentioned is really good, and unfortunately you can't see it very well in this picture, but just as the handle comes down and it loops around to hold on to the bucket, sometimes there's an opening there, and it's best if you can just take some black electrical tape and just close that off. You can see a little bit using some vet wrap that this side's been closed, but those will pierce nostrils pretty good too, okay? So there's a lot of times I'll walk into barns and I'll see this and I'll casually mention it, but I have to keep repeating myself too because there's different staff that will come in. So it's quite common that I'll see this. Here's an alternative to snaps. This is something that we use in our clinic. So it's a $20 or so device that you can use. So you're not using snaps at all. There's pros and cons. I've never had any injuries, knock on wood. But if the bucket is full of water, it can be a little bit more cumbersome to get it out of this system. Swollen eyes. It's absolutely necessary that that entire cornea is examined, including beneath the third eyelid. The third eyelid is that little flap of tissue that extends from the corner. Sometimes they're black pigment, sometimes they're flesh pigment. If the horse is sedate, you might find that third eyelid comes over. You'll see the same thing happen in dogs and cats, okay? Or if there's a lot of inflammation in the eye, the protective mechanism is that that third eyelid will usually cover as well. So sometimes swelling is so severe that it is extremely difficult to examine the eye, and you can even use an ultrasound then through the eyelids to visualize what is going on in that eye. The eye is so fluid filled that it makes like the most perfect organ to actually ultrasound. So we don't do a ton of it, but it's something that's there that we can do. So ultrasound can be performed to identify detached retinas and other abnormalities. So examining under the third eyelid, I just want to show you a couple of videos here. So I'm using a pair of forceps here, and I'm grabbing, the tissue that I'm actually grabbing is dark. I don't know if you can see that. It might just repeat itself there. So this is actually a tumor on the third eyelid. So you can just imagine if it's prolapsed here, it's going to cover probably about a third of that eye, a third of the cornea. So anything could be, in there. It could have a foreign body. You could have an ulcer. So if you're looking for staining for ulcers, you've got to make sure that you're pulling that flap back so you're not missing them. So this conjunctiva is extremely inflamed. So again, I think from this one here, there's a staining ulcer right here, the green you can see. But you can just imagine, you've got to pull back this all this conjunctiva. So sometimes what I'll use is a sterile cotton swab with some anesthetic on it, so they're actually not feeling it. But then you're going to lift up into all this conjunctiva so you can examine the entire cornea. So this is just showing an ultrasound. So again, we've got the ultrasound probe here going right on top of the eye. So it's going through the eyelid. And what you see here, this would be the eyelid surface. And then you've got the front, this little white line here actually is the cornea. And then you have, do you know the brown globs that you'll often see that extend from the iris, so the coloring of the eye? Does anyone know what I'm talking about? They're called corpora nigri bodies. Okay, some horses have them, they're huge. Some have them on the top of the iris, some on the bottom of the iris. Well, that's what we have right here, is this little glob. So this is the front aspect of the lens. This is the back aspect of the lens, this little white reflection here. And then we have a big fluid body right here at the back of the eye. And then at the very back, this is the area that you're going to look for detached retinas. So typically there's a characteristic fold. It almost looks like seagull wings that you would see if the eye, was severely traumatized. You could certainly see that. Even if the eye was so swollen, you couldn't see the eye itself. Corneal ulcerations, this is probably the biggest thing that you need to know about here. So the defect in the outer layer of the eye, any erosion to it can be referred to as a corneal ulceration. They can be caused by numerous things such as foreign bodies. It could be from hay, it could be from bedding, it could be a grass seed if you're out in the paddock, you've got some long bits of grass and that, and they're with their heads down. Can be from burrs as well. So you have to be extra careful when you're cleaning out those burrs from the forelock. Maybe even take a little towel, put the towel over top of the eyes, and then comb it out that way. But we commonly see burrs as the reason that they're having ulcerations too. Sometimes they're just really itchy horses. The flies are really bad, and they'll be rubbing and rubbing. They'll actually traumatize their eyes just from that. Usually what we'll do is we'll come in and we'll stain the eye. So it's the same sort of stain that you would have done if you went down to the emergency if you had something stuck in your eye. And what that stain will do is it's going to adhere to an area of the cornea that is injured essentially. So there's erosion to it. When they have these problems, it's really important that we're rechecking the eye to make sure that the treatment that we're asking you to do is actually healing it, so it's not getting any worse. Sometimes things can get complicated and there might be a fungal component to it, but we do want to make sure that things are going in the right direction, so we might be back in a few days' time and then maybe a week's time after that. Ulcers can hide under that third eyelid, so just be sure that you're looking at it closely. Some of these ulcers are difficult to heal, and despite treatment, they don't change in size, they just linger and linger and linger. We call those indolent ulcers. It's almost like the body loses its ability to realize that there still is a problem and it just kind of gives up. It's very frustrating, but sometimes this might look really crude, but you can actually see this is a scalpel blade that is just reversed, so it's not the cutting edge, it's more of the handle edge. And that actually is going to be scraped across the eye at the area where the ulcer isn't healing. And what that does is it actually wakes the eye up, wakes the body up to say, hey, you still have some healing to do, get back to it. And then hopefully at that point in time, you're going to see some blood vessels start crawling across. So this is just another protective means so that this horse that's getting quite a bit of treatments has a subpalpebral lavage system in place. We certainly don't want the horse rubbing the stitching out after going to that extent. Some people will see a horse with a swollen eye and they'll think, well, let me see what it does with some butyrbandamine. And the eye probably looks better the next day. So they figure, well, maybe I'm going to give it some more butyrbandamine the second day. And sometimes what happens is it's more than just eyelid swelling, and there's actually an ulcer underneath. NSAIDs, which is your non-steroidal anti-inflammatories such as butyrbandamine, They're great when they're used wisely and they're needed for pain relief, but if you overdo the use when you are treating an eye that's ulcerated, you're going to prevent blood vessels from growing. And the blood vessels are necessary in order to bring nutrients to heal the ulcer. You've got your eyelashes here, your conjunctiva, you've got all these little blood vessels that are extending from the outer aspect of the eye, growing towards the defect. And the defect is this grayish color. I don't think this one was stained just yet. If you look closely, there's all these little blood vessels here. And they grow at about 1 millimeter per day. So we have an idea when we see that, just how long that ulcer's been present. So some other examples of eye protection. This one in particular here, it can be sold at Brewbaker's for about $35. I think it's great. This particular case, they actually put small holes in it just to allow a little bit more breathing. But you do have to watch fly season, that you don't get those little tiny flies in there bothering the horse as well. So they're used, again, to reduce the risk of having the horse rub sutures, rubbing the cornea if they have allergies, and if there's a subpupillary lavage system in place, we want to make sure it's protected. And again, after they're recovering from a general anesthetic, we've got to make sure that we're protecting those eyes. So this is what we typically put on. Again, there's different forms of it, but you can see just how wide they're cut out around the eyes to protect them. So fly masks all year round. Sometimes even the winter, I'll recommend it because some horses are very sensitive to strong winds, and just a strong wind is enough to set up a mild abrasion to that cornea, believe it or not. So if you see them out in the winter time with them, you'll understand maybe why that horse has it. And the other thing too is there's some horses that are more susceptible to things like uveitis or squamous cell carcinoma. They don't have the pigment around their eye, so wearing a fly mask all year round is also beneficial. Ways of preventing injury, again, would be cutting your paddocks. Okay, make sure that grass isn't allowed to get too tall, burr bushes especially. You can, like I said earlier, you can clean out the forelocks with care, preventing the burrs from dropping into the eyes just by using a towel. So sometimes we're going to ask you on the phone as we're following up, do you think your horse is painful compared to the first day? And you might say, well, I don't really know. This is a really good tip here. So if looking at your horse's eye, if they have a painful eye, they'll usually squint. Okay, it's called blepharospasm. If you look at one eye and it's just mildly painful, it's just mildly squinting, and then you go to the other eye and you look, if it's mild, you're probably going to miss that painful eye. So I always recommend, whenever I have an eye case with them, stand in front of the horse where you can see both eyes at the same time, and you're going to look at that eyelash angle, okay? And they should be symmetrical. If you've got a painful eye, typically what happens is those eyelashes will be on a more vertical plane. And if it's mild, you'll probably still pick it up if you're looking this way. But if you're just going from one side of the horse to the other, there's a good chance you're going to miss that mildly painful eye. And you remember all my take-home messages? This is the biggie, okay? Leftover eye medication. Don't assume that your horse is dealing with the same eye issue as it may have had in the past. Never say never. This is a never case. So never place steroids into an eye that you have not had confirmed free of ulceration, or you risk losing the eye. So your BNPH, the H is your hydrocortisone. That's a steroid. Maxidex has, steroid in it. So if you're not sure, just don't put anything in. Talk to your veterinarian. Most of us do have a little stash of eye meds that are used up for the last 2, 3, 4, 5 years sometimes. We're all guilty of it. So it delays the healing, and so then the infection can get worse. Really try to avoid just grabbing something to put in.